If you're wondering how to become a pelvic floor physical therapist, this video is for you. We're going to go over my journey, the different courses I've taken, and different paths that you can take as a physical therapist, a new grad, a physical therapy student. My name is Christine. I'm a doctor of physical therapy, and I specialize in pelvic health. So I wrote down my notes so I don't forget what I want to talk about because there's quite a bit of things here. First of all, PT school. So I got into PT school, and that's where the journey began. During PT school, it felt like everyone knew what they wanted to do. So the sports people knew they were sports. Inpatient were super gunshot on inpatient. Peds were obsessed with peds. And I just had no idea where I fit in because it wasn't any of those. And I thought, all right, I'll just do general ortho. But I wasn't so passionate about it, which made it very difficult for me because I thought, wow, I just wasted 3 years of my life. It wasn't until the final year of school where I applied to do a full-time pelvic floor rotation, and I fell in love. So I applied for it because I had had pelvic floor physical therapy as a patient years prior to this. And when I saw it, I thought, well, let me give it a try. Maybe I'll like being on the other side of the table. And I absolutely did. So at that time, there were not a lot of pelvic floor rotations, and there weren't any in the area where I wanted to live. Moving wasn't an option for me because of personal reasons. So I thought, all right, I'll find a pelvic floor job and I will take the Con Ed courses and go on from there. And that's exactly what I did. I found a job that allowed me to do a mix of pelvic floor and ortho, and I had my certifications. I had my level 1 and level 2 certifications to treat pelvic health that I took before my rotation. I got those from Herman and Wallace, but you could also get them from the APTA pelvic health section. And I felt pretty confident with treating non-complex patients. Thankfully, I had coworkers that were very helpful and had years of experience, so they served as mentors to me. And that's the big thing. If you're not going to do a residency, finding a mentor at your job, or even not at your job, but it's always easier if they're there because you can call them into your office or your room to help you with the patient right then and there versus waiting until after work, calling, and going through that whole thing. So I was really lucky. I had a great mentor at work, and she helped me a lot. Now, from there, I was also taking classes all the time. Those first 2 years, I think I took at least one class every 1 to 3 months to perfect my skills, to learn new things. I was reading research articles, I was following people that taught me things, listening to podcasts, and really pushing myself to be the best I could for my patients. So right now, I know there's a lot more residencies for pelvic health. There just weren't at the time I graduated, which is fine because I think I reached the same end destination. It just took me a little longer to get there. That's the big thing. When you do a residency, you're in it for a year and you get all this mentorship, all these classes and information front loaded to you. Whereas if you're not doing that route, you take classes here and there, it's not as continuous, you're not learning from the same people, you might not have one steady mentor, or you might only have one wherever you work and you're limited to that. So there's the pros and cons of it, but a big pro is you're getting paid like a PT. You have flexibility, so if you have a family or want to start a family or want to travel, you can do all those things because you're learning on your own time. And that was really big for me. I am still always taking classes and always learning. Now, after that, you can choose, am I happy with just having the classes, or do I want to sit down and take a test to have the certification? And you can either do the pelvic rehab practitioner certification, there's one Herman and Wallace offers, or do the certification through the APTA pelvic health, which is a women's health certification. Either or, you end up at the same place, really. And honestly, there's a lot of great therapists I know that treat pelvic health that don't have either of them. I chose to sit down and take my pelvic rehab practitioner certification because I just wanted it. It, to me, felt like the last step from all the classes I've taken. And I'm happy I did it, but it didn't change much because I had already taken those classes and I was treating this way, and I have my mentors that I can call up. I found other pelvic floor therapists through classes where we've exchanged numbers and we'll text each other. There's Facebook groups that you could join, and if you have a really complicated patient, you just write it in there like, hey, this is the patient I'm seeing. Can I get advice? And so many people are willing to help, which I think is the best thing about our field is no one's gatekeeping information. We all want to learn together. We all want to grow. We all want to help our patients. There are a lot of different options for Con Ed. I'll tell you the ones I've used because those are the ones I have the most exposure to. So the first one is Herman and Wallace. I've taken almost all their classes. I absolutely love them and I love the way they teach, but some people say, well, I like the APTA more. That's fine too. I've taken classes with the APTA's pelvic health section. Those were also really great. EIM, Evidence in Motion, they have pelvic floor classes. They even have a certification now. So if you want to sit down and take that, it's like a 6-month or 8-month process, I think, don't quote me on that, where they go through different classes and at the end, you are a certified pelvic health specialist. MedBridge has a lot of really good classes on there that I've personally taken to help me with different populations like pediatrics or patients with neurological conditions or pregnancy and postpartum. So there's a lot on MedBridge and there's a lot of just general classes on there. I would recommend everyone to have a MedBridge account because it is extremely helpful. Pelvic Sanity and Celebrate Mulberry are the 2 podcasts I listen to all the time, and both those people offer classes that you can pay for and take. But I love their podcasts. Those are usually enough for me to learn and feel like I know what I'm doing. And if I want to learn a little more, I just go take their courses. Some are online, some are in person. It varies. Those are the classes I've taken, and I feel like they've been very helpful. I know that there's more out there. I just haven't been exposed to them. So I just talked about the companies where I've taken classes with. I trust, I know them, and I really like them. I think something that is really cool with pelvic health is you can work in a lot of different settings. So you could do inpatient, you could do neuro, you could do outpatient ortho mix where you see ortho, you see men, you see women. You can specialize in just seeing women during pregnancy and postpartum. You can even treat peds. So for me, I see men and women, mainly women, pregnancy, postpartum, pelvic pain, incontinence, constipation, and fecal incontinence. Those are my big ones that I see. And I've learned so much about chronic pain. I used to think that I did not understand persistent pain, that it was very difficult to treat, that I just was not good at it until I put the effort into taking classes and actually learning. Absolute game changer. And I think all pelvic health specialists should be really good at knowing pain and being able to explain it because we see so many patients that have chronic conditions and chronic pain. I think in order to be a good pelvic health specialist, you really need to be compassionate. You need to be able to zoom out and look at the person as a whole because we're not just treating their pelvic floor. We're looking at lifestyle, sleep hygiene, nutrition, stress, past trauma. They may have chronic pain or chronic conditions that impact their pelvic floor. Medications can impact their pelvic floor. So there are so many parts to this, and you need to be really passionate about it and able to zoom out and connect all the different pieces together. That's something you get better at as you go. And I'm not perfect, but I am putting in the effort every single day to learn more so I can treat my patients and give them the best care possible. I think anyone can do it if you really want to do it. But remember, you are treating people like I've had times where I've had urine and feces on me, and you need to be okay with that and not make your patient uncomfortable because that happened. The way someone can get urine on me and I'd be like, don't worry, it's fine. Or menstrual blood, and I'm like, it's okay, not a big deal. Or there's stuff on the floor after. You cannot make people uncomfortable. You can't shy away from it because it's normal, it's natural, and you need to be okay talking about really difficult topics. like sex, which can make people very uncomfortable because you're getting specific. Does it hurt? Does it hurt at entrance? Does it hurt with deeper penetration? What positions does it hurt in? So you get very personal with your patients, which I actually love. That's one of my favorite parts, is that we are talking about things that you normally would not tell anyone. But in that room, it is a safe place, it is a sacred place, and nothing is TMI. If you have any questions, you can always send me a message. I will send you any resources I have, and I'm happy to chat or give you my advice if you're confused on what to do or have more questions. Take care and enjoy the rest of your week.